Welcome everyone to the Paloma Health speaker series. We are talking today about hearing loss and hypothyroidism. And we have two awesome speakers with us. We've got Dr. Keese and Mary Shomon. Dr. Keese is an audiologist and Mary Shomon is a thyroid health coach. Both have a ton of information for us. Katie, I'm gonna read your bio so that I don't mess up all of your amazing accolades. But before we do that, just a little bit of context. Paloma Health is an online medical practice focused exclusively on testing and treating hypothyroidism and Hashimoto's. And we have a ton of free educational resources and community opportunities for people to learn about and match up with other people who are living with the same condition as them. So this is our monthly speaker series. We do this once a month and we do a deep dive into a topic related to thyroid health. So again, today we're talking about hearing loss and hypothyroidism in honor of May's Better Hearing and Speech Month. So we're just sneaking it in. This event is about 60 minutes long. We're going to start with intros from both of our speakers, and then we've got a panel discussion prepared already. And then we're going to open it up to live Q&A for those of you that are joining us live. So go ahead and start dropping your questions into the chat at the bottom of your screen, either ones you've come with already, or ones that come up as our speakers are presenting. So without further ado, I'm going to introduce Dr. Keese, and I am going to read your bio so that I don't mess it up. Katie is an internationally experienced audiologist. She's worked in a variety of settings within the hearing industry, including diagnostic testing on adults and pediatrics, education and training, oral rehab, and hearing loss prevention. She earned her Doctor of Audiology degree from the University of Oklahoma Health Sciences Center, and she's a passionate believer that hearing healthcare should not be a luxury, but should be easily accessible and affordable to anyone regardless of their circumstances. And Dr. Keese shares that belief with us. We think healthcare should be, affordable and accessible to everyone. It shouldn't be hard to get the care that we need. Outside of work, you can find Katie exploring the outdoors, most likely with a camera in hand. So maybe you can show us where to see your photography later. But Katie, I'm going to pass it over to you to tell us a bit more about who you are, why you're excited about this topic, and then maybe just to set us up for the conversation tonight, you could talk a little bit about the different types of hearing loss and the signs and symptoms of hearing issues.
Yeah, absolutely. Thank you so much. I'm very excited to be here. And yes, absolute believer in affordability for healthcare. So when you guys asked me to do this, I was super excited because clearly our missions align. So thank you so much. Great. So yeah, as you said, I'm Dr. Keese. I'm an audiologist. I'm currently based in Phoenix, Arizona. And so that's why it's very easy to go shoot a lot of photography out here and take in the beauty because it's very naturally gorgeous. But yeah, so I'm super excited to talk about the different types of hearing loss and kind of what you guys can expect when it comes to hearing loss and what you can do about it. So as far as hearing loss goes, before I kind of talk about the types of hearing loss, I want to first kind of briefly go over the anatomy so you can better understand what we're looking at when we're looking at hearing. So there are three main parts of the ear: the outer ear, the middle ear, and the inner ear. The outer ear is just your actual physical ear, which is called the pinna, and that extends into the ear canal all the way up to your eardrum. The middle ear, that goes beyond the eardrum, and that includes the three tiniest bones in the body, which are called the ossicles. And then beyond that, we have the inner ear, and that includes your hearing organ called the cochlea. So the cochlea is a little snail-shaped organ. The snail-shaped portion deals with hearing, and then there are three loops. We call those canals. Those deal with balance, but we're going to be really kind of talking about the hearing portion of that today. And within the hearing portion of the cochlea, you have these little fibers that move in response to sound. We call those hair cells. They send information up to the brain, and that's how we hear. So when we're looking at the three different types, or not types, but three different parts of the ear and how they're related to hearing loss, there you'll see a common number theme. There are three different types of hearing loss. So there's sensory neural, conductive, and mixed hearing loss. So sensory neural is definitely the most common one. About 90% of hearing loss deals with sensory neural hearing loss, and that is damage in that little cochlea. So that little hearing organ, those fibers, those hair cells that I was talking about, they have some sort of damage, and that is not in all cases, but in a lot of cases, a permanent sort of hearing loss. Then you have a conductive hearing loss, and that can deal with the outer and the middle portion of the ear. So that can be anything from there's a blockage, whether that be earwax, it can come from an injury, it can come from allergies and fluid behind the middle ear. So there are a few things that can cause that. And then there's mixed hearing loss. And mixed hearing loss is exactly what it sounds like. It's a combination of the two. So maybe you do have a permanent hearing loss, whether that's from noise exposure, genetics. There could be lots of different things that we sometimes can pinpoint, sometimes we can't, but you could have a permanent hearing loss and then something temporarily blocking it that's making it worse than it actually is. So those are kind of the three main different types of hearing loss that we look at. And then as far as the signs and symptoms of hearing loss go, it's something that is not obvious on the outside. It's not a rash that you see. You're not wearing a badge or anything like that saying you have hearing loss. So it often goes very untreated for a lot of people. Even people who have it might not always realize that they have it for many, many years. So what are the signs to kind of look for? You can look for this in people you know, or you yourself might have some of these signs after listening to them. But a very common complaint is I hear people but don't understand what they're saying. So maybe one-on-one you're doing okay, but throw in some background noise and it's really hard to distinguish what someone is saying. Maybe people are turning the TV up and up and up and they make it louder, but loudness doesn't always make it more clear. You might have ringing in the ears, or there could be a whole lot of different reasons why you just go, you know what, I don't think I'm hearing as well as I once was. And that's when it's time to get your hearing tested and follow up with someone to see what you can do.
Awesome. Thanks, Katie. I think that's a really helpful setup for our conversation today to understand how our ears, the anatomy of our ear even. Mary, I'm going to pass it over to you. Mary Shomon is a thyroid health coach and an internationally recognized author and patient advocate. She's written over 15 books on thyroid health and hormone health, and she's an advisor to Paloma Health. So she's a wealth of knowledge who did a survey. You can tell us a bit about your research, Mary, related to hypothyroidism and hearing loss last year, which was sort of the impetus for this conversation. I think you've done a lot of really interesting research. So I'll pass it over to you to tell us a bit more about that.
Sure. Thanks, Katie. Well, I've been a thyroid advocate for 25 plus years now. And so I've been talking to so many thyroid patients, thousands and thousands a year, forever. And I have to say that when I started to work on a new sort of article and research project on hearing loss, it really was an eye opener and an ear opener for me, because I really had not had that much awareness of the link to hearing loss. When you look at the standard list of symptoms for hypothyroidism, you don't usually see hearing problems or hearing loss on that standard list of, the weight gain and the fatigue and the hair and skin and all of those things. I very rarely have I seen hearing loss. Yet when I started to get into it, and then I ran a survey, as Katie was mentioning, on my Facebook and on my website, to find out how many people had been had a hearing evaluation at any point along the way, how many people had hearing related symptoms, hearing loss, tinnitus or tinnitus. I know there's different ways that people pronounce it, ringing in the ears. It's turned out that so many hypothyroid patients were describing this. And when I started to then look at the literature and the journal research and stuff, it is very, very common. And yet our doctors don't tell us about it for the most part. We don't really know about it for the most part. And how many of you watching have had a baseline hearing test or an audiology exam or an audiogram at the point when you were diagnosed, which is really what is recommended, so that you can get some sort of baseline understanding of where is your hearing status now, so that you can check down the road if you notice any differences. And it's interesting, Katie knows this, because around the same time I was working on this article and research, I myself was starting to have some hearing problems, and I was trying to figure out what's going on. And for me, as Katie Keese was saying, all of a sudden I was turning the TV volume up and up and up, and my housemate said, do you have to have it so loud? And I said, I can't even hear it. I keep wanting to turn it up further. The other thing I noticed was everything on my phone, my iPhone sounded muffled. And I thought, oh, the phone must be going bad. And it was a fairly new iPhone. And I thought, why is my and I couldn't really hear words that clearly and things, especially in my left ear. So I'm researching around. So I went and found one of these online hearing tests, put on my headphones, did the hearing test, and it showed that I had a fair amount of hearing loss in my left ear at high frequencies. And I thought, what's this going on? So a couple of days later, I realized, okay, because it started to make sense. I was having some earwax buildup, which is actually much more common in people with hypothyroidism than the average population. So luckily, in my case, I only went for about a week going around going, what did you say? And I went to the ENT doctor, and he used this little vacuum, which was amazing, and just vacuumed out the wax in about 2 minutes. And all of a sudden, it was like the whole world had cleared up for me. And it was really amazing to me how frustrating and exhausting and kind of depressing it is to feel that disconnect when you can't really hear something very well. Now, in my case, it was easily resolved, which is, wonderful. But it's not always that way for a lot of people. And I do really worry that there are a lot of thyroid patients out there that are struggling with any one of these different types of hearing loss that Katie was outlining and don't realize what's going on, or that they need to be paying much closer attention to this. So I'm sort of considering this that hearing loss is the unspoken about thyroid symptom. It's a symptom that people are simply not acknowledging exists and is a problem for all of us. So, Katie, I'm gonna go ahead and share my screen because I wanted to show how. Let's see. Let me make sure that I'm getting this correct. Where is this? Okay, here we go. Okay, hold on. Let me see what I need to do here. Okay, so I wanted to talk a little bit about, can you folks see this? Can you see my screen? Okay, good. How hearing loss is, as I said, a frequently overlooked symptom of Hashimoto's and hypothyroidism. And Katie was telling us about the different kinds of hearing loss. And for the vast majority of people, it's that sensory neural. About 90% of the hearing issues in the general population and in Hashimoto's and hypothyroidism tends to be the sensory neural. But we do have a higher risk than the average population, as I said, of conductive, especially due to that earwax. Now, I'm not exactly sure what the scientific mechanism is for the increased risk of earwax in people with thyroid problems, but it's documented and we know that it exists. The other increased risk is for an autoimmune type of hearing loss called autoimmune inner ear disease. And as we know, when you have an autoimmune condition like Hashimoto's, that puts you at a slightly increased risk of other autoimmune conditions. And in the case of autoimmune inner ear disease, sometimes it's referred to as AIED, you can have antibodies that attack your inner ear itself, which can cause partial or in some cases dramatically fast hearing loss. So these are some things to be aware of. The other thing, and this one came up in my survey that we were talking about, the most common complaint of thyroid patients who did not realize that this was related to their thyroid issue potentially is the tinnitus or tinnitus. Katie's going to tell us what the official pronunciation is, although I keep hearing it both ways from experts. So in any case, this is the ringing, the buzzing, the hissing, the roaring, that sound that you can't get out of your ear. And it can be continuous or it can be intermittent. And I think almost everyone's had it at some point or another, especially if you, like me, liked to go to really loud rock concerts when you were young. And then, for the next day or two, you'd have this kind of ringing and irritating sound in your ear. Usually that's probably evidence that it was too loud and you're damaging something temporarily. But that is the most common complaint of people with thyroid issues. Also wanted to go through some of the statistics because this is, I think, is going to surprise people. 25% of hypothyroid patients have some degree of mild to moderate sensory neural hearing loss. 25%. That is a huge number. That's more than the people who would report having other kinds of common thyroid symptoms. Yet again, it's not one that is front and center for us, but it needs to be. People with hypothyroidism, especially after the age of 50, are also at increased risk of something called sudden sensory neural hearing loss, or SSNHL. And this is rapid hearing loss. It's like it happens right away, or it dramatically drops within about a 72-hour period. And I'm guessing Katie can probably tell us a little bit more about that in a moment. But interestingly, optimal hypothyroidism treatment is a factor in recovery from SSNHL. So the thyroid and the hearing loss, the sensory neural and sudden hearing loss are definitely related. Babies born with congenital hypothyroidism, this is hypothyroidism at birth, also have a lifelong risk of hearing loss, and that risk is 3 times higher than the general population. And it's estimated that mild hearing loss is found in at least 20% of congenital hypothyroidism patients. So if you were hypothyroid as an infant and you've been on lifelong thyroid replacement, you need to be getting regular thyroid hearing checkups, because it's very possible that by the time you hit adulthood, you may have some evidence of even mild hearing loss. And it's estimated that by early adulthood, 17% of congenital hypothyroidism patients actually require hearing support. So that would be likely hearing aids of some sort. So this is no joke with congenital hypothyroidism as well. Hashimoto's is also, as we mentioned, related to an increased risk of the autoimmune inner ear disease. And in AIED, we see these antibodies targeting that inner ear, creating inflammation. You can have that ringing in the ears. You can have fluctuating, progressive, or sudden sensory neural hearing loss in one or both ears. It's oftentimes both ears, I think, in this autoimmune form of it. But again, keeping in mind that there is that increased risk, and always at various points along the way, the risk goes up the more untreated, undiagnosed, or poorly treated your thyroid condition is. Hashimoto's is also related to Meniere's disease, and the symptoms are, again, the ringing in the ears, vertigo or dizziness, feeling unsteady, a fullness in your ear, and hearing loss. It's turned out that the rates of hypothyroidism in people diagnosed with Meniere's is so high that experts recommend anybody with Meniere's is screened for hypothyroidism. And good news here, after 12 weeks of optimal hypothyroidism treatment, almost all Meniere's patients will experience improvement in their hearing. And then there are some other connections between your thyroid and hearing loss. There is the drug Tepezza. You've probably seen it advertised on TV. They're advertising it all the time these days for thyroid eye disease. It can actually cause temporary or irreversible permanent hearing loss. And again, the tinnitus problem with the ringing in the ears. Also, propylthiouracil, PTU, an anti-thyroid drug, not as commonly used as Tapazole or methimazole these days, but it's still used by a fair number of patients to treat Graves' disease and hyperthyroidism, is also associated with sudden sensory neural hearing loss. Some people who have medullary or anaplastic thyroid cancers, these are fairly rare thyroid cancers, have something called external beam radiation treatment. This is also associated with hearing loss. Just to calm people down though, radioactive iodine, RAI, is not associated with hearing loss. And then finally, there's a condition called Pendred syndrome, which is a genetic condition that's associated with goiter or an enlarged thyroid. And Pendred patients have a higher risk of having hearing loss in infancy or early childhood. So typically it's not associated with the hypothyroidism per se, but the goiter, the enlarged thyroid, is usually very evident in Pendred patients. So that kind of gives you a rundown of where we are and the many, many links between thyroid problems and hearing problems, and the autoimmune component of thyroid problems and autoimmune hearing problems. And it's really, again, frustrating to me how overlooked it is. And so that's why I'm so excited that Paloma is taking the initiative to really help spread the word for Better Hearing and Speech Month, and that we have Dr. Katie Keese with us to help educate us more about the audiology and hearing end of things. So, Katie Keese, did you have any sort of clarifications you wanted to add to some of the things that I said, especially like maybe about the sudden sensory neural hearing loss?
Yeah, definitely. And I will say tomato, tinnitus, tinnitus. I say tinnitus, but I understand tinnitus just as much to understand what you're trying to say. So either is fine.
Great, thank you.
No, I love that we're actually talking about sudden sensory neural hearing loss, because that is something that is completely overlooked in so many different medical fields, I feel. So I don't know who all exactly is in our audience, but if we have any physicians, primary care physicians, specialty physicians, anyone in the medical field, whether you're a nurse, if anyone ever says that they had a sudden hearing loss where they just woke up one day and it's gone, that should be a huge red flag. Call your closest ear, nose, and throat physician, say the word sudden hearing loss, and you will skip any sort of wait period, because it's all about your time window of getting in. Because as you mentioned, it could be a permanent type of hearing loss, but there are treatments. It's kind of the one sort of sensory neural hearing loss that we do know that we have a potential to save. So the sooner you can get in to see an ear, nose, and throat physician, they can start treatments. Some of them are just as simple as an oral steroid that you can take. So yeah, anyone in the audience who ever knows of anyone who says they have a sudden hearing loss, straight to the ENT, say those words, and they will get you in ASAP to try and save what they can. So yeah, that's a huge one that is definitely not talked about enough, for sure.
Great, thank you. Thanks for clarifying on the tinnitus debate.
Yeah. I have tinnitus, and I've been saying tinnitus for years. So now I know there's even another way to pronounce this word. Katie, I'm hoping just to follow up from what Mary's talked about, obviously there's an importance to get our hearing checked. Maybe you can tell us about, the frequency for that, but also can you break down for us what happens during a hearing evaluation and audiogram?
Yeah, absolutely. And it is probably the least painful thing you can do for your overall health. So it's not a scary appointment at all. Kind of like Mary, what you were saying, it's great to have a baseline because there's so many things that can contribute, especially when medication is involved. There's a lot of different things that can contribute to why your hearing might change. And a lot of those can be medically dealt with if appropriate. So what goes on when you're getting an audiogram? I bet most of us here at some point in school probably did a screening. I don't know if you guys have done one since then, but as I said, it's very simple and straightforward, and it's not a scary thing. Even if you hate it and you go, oh my gosh, they're playing beeps. I think I'm hearing it in my head now. I don't know what's real, what's not. It's okay. But really all it entails is you'll go to an audiologist and they'll gather kind of your medical history. So yeah, anything that is worth saying, definitely let them know if you have hyperthyroidism, because clearly that's very important to your overall health and well-being. So they'll gather a medical history. They will look in your ears, check for any sort of blockages. Like I said, we're really evaluating that outer ear portion because I will just kind of say that earwax buildup alone, that can trigger ringing in your ears. So it doesn't have to be hearing loss. A lot of people it is, but yeah, as you know, Mary, that alone can be, oh my gosh, maybe I do need to go get my ears cleaned. And I will just say, PSA, don't use Q-tips. If you do, I will ignore it, but sometimes Q-tips can push it further down and actually impact the earwax in your ears. So it's always best to just go to a licensed professional to remove it if you need to, but we don't go off track. So at the actual hearing evaluation, they'll look in your ears, check to see what's going on in your outer ear, in your ear canal, and then they'll do something called a tympanogram. So it's tympanometry. It's this tiny little probe that they put in your ear. It does create a seal and it blows some air in your ear and it kind of feels like you're going up and down in an airplane real quick. And what that's doing is that's checking to see how the middle or the bones in the middle ear are working. Is your eardrum moving the way it should? If not, there are things that we can do about that, but that's what that check is for. And then they'll do the beep test that I'm sure everyone here is familiar with, and we plot that on what's called an audiogram. So it's a little graph. It goes from 250 hertz up to usually 8,000. We can hear beyond that, but we test those frequencies because that's where speech falls. So one thing that I should have brought a picture of, but if you just want to do a quick Google search of something called the speech banana, it's a beautiful graph that looks like a hearing test, but it shows where certain sounds of the English speech fall related to frequency and decibel level, so volume. So it's a great visual image if you do have hearing loss to show a partner or friends, family, where your hearing loss is and what speech sounds you're not hearing. So they do the beep test. That's whether with its headphones that sit on the ear, or they might use little foam tips that they put in the ear. And this is what's gathering air conduction scores. So what that means is it's testing the whole hearing system. So the 3 different parts that I talked about initially, it's testing to see how all 3 of those are working. And then they'll play beeps. Obviously, they want to get to the softest sound that you can hear, and we call that your threshold. Then they'll do a bone conduction test. So it's another portion of the beep test, but instead of headphones, it's a little headband with an oscillator. If you just take your finger and feel right behind your ear, that's your bone right there. And we set it on the bone, and it actually skips the outer and middle ear and is just testing how your inner ear is working. So if there's a big discrepancy between the air scores and the bone scores, we know, okay, there's something going on in the outer or middle ear that likely we can address. So after the beep test, they will go on to test your speech understanding, because at the end of the day, it's the brain that hears, not the ears. So we do want to see how you are doing in speech. This is usually just in quiet. Sometimes we might do speech and noise testing to see how you're doing in noise, because that's one of the #1 areas where people struggle to understand is in noise, not quiet. But the speech test is really to kind of help us as a counseling tool, guide what realistic expectations you can expect. So if you do have a hearing loss, but you're only getting maybe about 30% of the words right, when we say the word dog, say the word Zoom. If you're repeating those and you're really only getting about 30 to 40% of those words right, well, that tells me that when I'm coming up with a plan for you and your hearing health, I need to include as many people as possible in your daily life to help you with that. Because hearing aids, they help, but they are not a cure. So at the end of the day, it's not going to restore things perfectly, but with the help of hearing aids and others around you, I know I'm kind of getting into the treatment bit, but it's really important to involve as many people as you can. So that's kind of the overall picture of what happens at a hearing test. Like I said, it's very painless. There are no needles involved, nothing scary. And really, it can take maybe about 30 minutes max at most. And it's something that is great to use as a baseline before any sort of treatments. Moving forward, it's great to get it on an annual basis, especially if you do know there is hearing loss. Probably no more than 2 years you want to let go between getting a hearing test, just to compare.
Thanks for sharing all that information. I am going to just take us out of order a little bit here so that we can address what you started to talk about treatment. We also have a question from Susan, I think. Sandra, excuse me, about her question is, any suggestions on how to specifically diagnose hearing loss? Which is a little bit of what you've just talked about, but how do you diagnose what's causing it? Does that matter in treatment? I'm adding some questions here. She's had hypo and Hashimoto's for about 16 years. That was a long-winded question, but how do you diagnose a specific cause? And then we can maybe talk a little bit about the different ways hearing loss is treated.
Yeah, absolutely. Great question. So sometimes we can pinpoint the cause, sometimes we can't. So you mentioned Meniere's disease, for example. That has a very specific pattern of what the thresholds look like when we plot it out on that audiogram. So there are certain things where you go, oh, there's a particular notch at this frequency. That's indicative of noise exposure. Oh, there's a conductive low frequency hearing loss. That's indicative of Meniere's, things like that. So there are certain patterns, and we call it our test battery. All those things that I just mentioned we do during a hearing evaluation. Certain signs will lead us specifically to something. Sometimes it doesn't. And sometimes you can't quite pinpoint that. Genetics plays a huge role in that as well. So taking a very thorough case history on if there is anything in the family history. I mean, sometimes we have people who are adopted and don't know anything about that. So we can't necessarily point to that. Not everyone wants to get genetic testing. So Again, sometimes we can pinpoint things. Sometimes you go, you know what, it doesn't matter where it came from, only here's what I can do to treat it moving forward. So as far as treatment goes, it definitely depends on the type of hearing loss you have. As I mentioned, there are 3 main types, and I guess 4 if we're talking about sudden hearing loss as well. So just to recap, sudden hearing loss, go to your ENT immediately. There are several different medical options that they can do to hopefully save some of that. If we're looking at a conductive hearing loss, so again, there's something going on in the outer or the middle ear, a lot of times that can be medically managed if it is just a pure conductive hearing loss. So your hearing organ is working great, but something in the outer or the middle ear is making it worse at the moment. So if it's earwax, we can remove it. If it's a foreign object, we can remove it. If there's fluid behind the eardrum for whatever reason, sometimes there are things that you can do with an ear, nose, and throat physician. They can put in PE tubes, which are pressure equalization tubes. A lot of children have them. So really, if there's anything that needs to be medically managed, it is definitely a discussion to have with your a physician, ideally an ear, nose, and throat physician who could, if necessary, perform whatever medical management that is. That being said, sometimes people opt out of anything that requires a surgery, which is totally fine. You're allowed to do that. And if that's the case, then hearing aids is also a viable treatment for that. For sensory neural hearing loss, often it's you come up with a whole oral rehabilitation plan, which does often include hearing aids. Now, depending on the severity of the hearing loss, there are different styles and types. So some people can get away with just a very small, discrete hearing aid. Others, if it is more severe, they do need something blocking their ear, maybe something a bit larger. And in some cases, there are implantable devices, again, by ear, nose, and throat physicians if necessary. So there's a huge range of treatment for sensory neural hearing loss. And then again, if it's mixed, it involves a very collaboration between an ear, nose, and throat physician, a primary care physician, and an audiologist, just to really make sure if I'm taking care of this, you're taking care of that, and everything is being followed up from all different areas. So a wide variety of treatments, but I will also give a little kind of, again, another little PSA. Hearing protection is the biggest thing that you can use to prevent noise-induced hearing loss. So I also like the loud concerts and that kind of ringing after a concert that you were talking about. It's actually called a temporary threshold shift, a TRT. And it does, it damages your hearing a little bit. And those hair cells that I was talking about, basically every time you damage it, they come back, but just not as strong as they once were before. So the best thing that you can do to prevent hearing loss is try and protect it as much as possible. So there's my little treatment spiel.
I like the PSA. I feel like the same is true of our eyes and of our skin. You know, we have all these protective measures. So it makes a ton of sense that we should also be taking like proactive preventative measures for our hearing. Thank you for talking about treatment options for hearing loss. And then Mary, I want to lob this over to you. If someone has hypothyroidism or Hashimoto's and is experiencing hearing loss, my question is, does thyroid treatment resolve hearing loss and or hearing problems?
Okay. I'm going to show you another slide here. So, I mean, this is the good news. If your hearing loss is caused by undiagnosed or poorly treated hypothyroidism, and again, as Katie Keese said, we need a really knowledgeable ENT and audiology consult to get to the root of this, because it may be something that really has nothing to do with our thyroid. But if there's not an obvious rationale here, the good news is that 6 to 12 months of optimal thyroid hormone replacement treatment can improve hearing in nearly 50% of people who are hypothyroid with hearing issues. And hearing loss problems can be completely reversed in 15% of the patients. I heard an interesting story from a woman who said that she was living with her mother, and her mother was having some hearing problems that had kind of come on rapidly, but they didn't go to see anyone or get any evaluation of it. And it had gotten to the point where they were really almost unable to communicate. And the woman was having a thyroid checkup, and it turned out that she had kind of unilaterally decided to not take her thyroid medication. And she had almost lost all of her hearing. And, the doctor and the daughter said, get back on the thyroid med. She did. Within 2 to 3 weeks, the woman's hearing was completely back to normal. So, I mean, that's a very dramatic kind of situation, and it was very rapid, but it's not out of the realm of possibility that whatever you're doing with your ENT and your audiologist, all these good treatments, one of the most important steps, because this is what Paloma's about, is making sure that if you have hypothyroidism, it's diagnosed in the first place. And number two, that it's optimally treated. It's not enough for a doctor to say, hey, I got a thyroid problem here, let me throw some medicine at you, come back in a year. They need to really make sure that you are getting to a really good place where your levels are optimal and you have the maximum amount of symptom relief, because it's only going to help the hearing. It's certainly not going to hurt it if you're getting optimal treatment. May not be the one-stop solution to everything, as we know from what Katie is talking about. There may be medications and other sorts of treatments that are coming into the picture, but it's certainly going to help in some cases. And why not at least get that off the table as part of the contributions to your problem? So this is another thing that I really want to urge people. When we're over 50 and we start to see more people having issues with hearing, this is also a time when, if your parent or your grandparent or your spouse or your partner is starting to have hearing issues, have them get a complete thyroid check too. Have them evaluate their thyroid. And, Paloma has a home test kit. You don't even have to go in for blood tests and have them stick you in the arm. You can just do a finger prick. It's painless. It's very inexpensive. You can mail it in from the comfort of your house, and you get a comprehensive evaluation of your thyroid levels. And so, I mean, honestly, for somebody with hearing issues, that should be a no-brainer. At least get into your doctor for a thyroid panel, or at least go ahead and get a Paloma test kit and check your thyroid as part of this process. But again, it's good news that there are a lot of different ways that the thyroid and the hearing interact, and getting that thyroid properly diagnosed and optimally treated can definitely be part of a happy solution to a hearing loss issue. All right, I am taking it off the page there.
Thanks, Mary. One last panel question for you to follow up from what you've just said. The question is, when and how often should thyroid patients have a hearing evaluation done? Is this different than the normal population? What's your experience been?
Okay, I'm going back one more time to my picture here. And we will go to the, okay, so when and how often should you have your hearing evaluated? Well, first of all, you can do a self-check on your hearing anytime. I've included a link here for one of the online hearing tests, and Katie Keese may have some other recommendations for some good online hearing tests. There's a lot of different ones available online. This is one that's pretty reputable, and Katie can probably share some others with us as well. That's the one that I did that found the high frequency hearing loss for me. I am now a firm believer that anyone who's diagnosed with Hashimoto's or hypothyroidism should have a baseline hearing evaluation and audiogram. Basically, go through that process that Katie just described, which was, by the way, extremely fascinating, because I didn't know there was more to it than just the beep test. I thought that was the only part of it, but all these other tests that you're talking about, Katie, are really interesting to me, that go into that evaluation. But if you can get a baseline hearing evaluation, then, 5 years, 10 years, 20 years later, if you start to notice you have issues, there'll be a point of comparison so they can see where these are. And the more data that's coming in, the more likely your ENT and audiologist can pinpoint some of the more specific possible causes or triggers and help you find solutions. I'm now a firm believer in getting a regular hearing evaluation annually. And again, I haven't done this myself, so this is something I'm going to start doing very regularly. And just to reinforce and reiterate what Katie said, if you have sudden hearing loss, new onset of hearing loss, or acute hearing loss that happens very quickly or surprisingly, get yourself to an ENT immediately, because time is of the essence and there are things that you can do. But if you wait a week or 2 or 3 or 4, you may be losing that window of opportunity to get the kinds of treatments that could help you save the hearing you have, or even get back to a better baseline period point. So we want to just make sure that we are doing everything we possibly can to take. Oh, I never shared my my screen, did I?
I shared the link in the chat.
Okay, good. Yeah, I thought I was sharing it, but I'm being spaced out here. But anyway, the gist of it is, go ahead and make sure that you get a baseline, get a regular evaluation, and if you have anything unusual that's sudden, rapid, or extensive, get yourself to an ENT immediately. Katie, would you concur with that?
Yeah, absolutely. And I love that you suggest even just doing an online screening, because that is such a great free place to start. So whether it's yourself or a loved one and you go, oh my God, I know that they're struggling with hearing loss, but they just won't do anything about it. Maybe take the test, and it can be a whole family affair and they can try it too. Because yeah, it's one of those things. A lot of people don't even realize they have it or what they're missing out on until they get your hearing back, whether that's through some sort of treatment or hearing aids alone. So it's something that a lot of people just don't realize what they're missing out on. And just a little fun fact that I like to throw out is it takes someone from the time they have hearing loss or they're aware of having hearing loss 7 years before they actually do anything about it. That's the average wait time. So anytime sooner than that, you're well above average. So but also if you have someone who's dragging their heels a little bit, just know that's very normal, because it's a big emotional decision as well to do something about your hearing, because we don't like to think that there's anything wrong with us, that it's, you know, it's the phone that's muffled, it's everyone else that's not speaking loud enough, those sorts of things. So a great free, non-scary place to start is, like you said, an online screening, which can tell you a lot.
Awesome. 7 years is a long time. I mean, I have a close relative who I think this will be a great resource to send to them, because you're right. You're missing out when you can't hear everything. We've got a lot of questions for the both of you from our audience today, so we'll get to as many of them as possible. Mary, the first one is for you, and it's not even directly hearing related. It's about how you partner with your doctor, your thyroid doctor. So the question is, if your thyroid doctor is not taking you seriously about hearing loss as a symptom, or really if your thyroid doctor is not taking you seriously about any symptom you present, what should you do?
Well, I guess the question there is what your personal resources are, because number one, I mean, my first recommendation is get a new doctor. Get a new thyroid doctor. I always use an example, and sometimes I think the doctors don't like it, but if I keep going to a plumber and trying to have that plumber fix my leaky faucet, and they keep coming and they can't fix the faucet, what do I keep giving them another chance? And no, eventually I say I'm going to get a new plumber. So if your doctor keeps telling you this doesn't have anything to do and that doesn't, and you're not feeling well, unless you are stuck with that doctor and you're living in some remote part of the world where you can't see anyone else or go anywhere else, honestly, cut your losses and move on and find a new doctor. I mean, this is where just to give a shout out to Paloma. Paloma is a virtual medical practice, so you don't have to have a doctor in your nearby town, and you don't have to drive 4 hours to see somebody. You can, in many cases, find somebody that practices in your state, but who's going to see you the same way we're all looking at each other right now on the screen. And you'll have blood work, you'll talk to them, they'll evaluate things and be able to get you the kind of treatment. And that's the one good thing about good thyroid doctors, including the docs at Paloma, but good thyroid doctors understand that these symptoms are signs that your thyroid treatment is not optimal. And when they have gotten you optimal, and if you're still struggling with certain symptoms, they're going to look farther. They're going to look deeper and try to help you get to the answers and the solutions. So partner, there's no point in trying to partner with someone who doesn't want to dance. Go find somebody who does. And whether that's, changing doctors at your HMO or seeing a different doctor in the practice that's covered by your insurance, or reaching out and going out of your normal systems that you've been using and, setting up a new relationship with a doctor from Paloma. I always feel like move fast to get to the right person that's going to really be your partner. You can't teach them how to partner. Find somebody who already knows how to be your partner.
Yeah, that's awesome. And I think that's super helpful. We have some resources on our website, articles about, how to stand up for yourself as a patient and how to find the right doctor for you, because a match for you, Mary, might be a different match for me in terms of, how we interact and partner with our healthcare providers.
Right.
Katie, our next question from the audience is for you. There's been a couple questions about tinnitus. I think the general question is, what can you specifically do about tinnitus? I've experienced, this is great. I'm interested also. This is not my question, but I've experienced it for a long time. Is there a solution to this hearing problem?
Yeah, absolutely. And that's a great question. So as I kind of mentioned before, earwax, a blockage in the ear, can contribute to the ringing. But a lot of times it can stem from hearing loss, even if it's super, super mild. And that's because from that damage to the inner ear that I was talking about initially, basically it's sending information up to the brain, but when it's damaged, sometimes it's just not sending properly and kind of making up its own sound. And a lot of people with ringing in the ears, they notice it most at night or in quiet environments. And that's because it's like, I love the analogy of a candle in the room. A candle in a lit room, you don't really notice it, but turn out the lights and that's all you notice. And it's the same with ringing in the ears. So number one, I would recommend go get a hearing test, see if there's even a mild hearing loss. And if so, hearing aids actually are very successful with the alleviation of ringing in the ears. If you don't have a hearing loss, that's okay, because there's still treatment. A lot of it is very, very subjective and personal. So kind of like what you were saying with doctors, what works for someone might not work for someone else. But as far as treatment plans go, you can either reach out to a specialist. So a lot of times that is an audiologist or a hearing aid dispenser in your local area, or there might be someone who just specializes in tinnitus treatment. You can reach out to any of those people to ask, what can I do to help? There are all sorts of apps out there that will, I can talk a little bit about sound therapy and what it is. It's the introduction of an additional sound stimulus to help distract the brain. So there are so many free apps. If you just search white noise, that's kind of the common one, but it doesn't have to just be white noise. It can be a babbling brook. It can be lots of different things. So again, it's so subjective and personal that I can't tell you what will or won't work for you. You just kind of have to play around with it. But what we do is we retrain the brain to hear it, but not focus on the ringing. So again, unfortunately, there's no cure for tinnitus as it stands today. If anyone claims there is, maybe it's a bit of placebo, but hey, at the end of the day, whatever works, works. But if you really want to look at kind of retraining your brain, you can find some of these sound generating apps, listen to it. Maybe it can be for an hour. Maybe it can just be for 30 minutes a day. Listen to it, present it so much so that you almost cover the ringing in your ears, but not quite. So don't mask it and cover it completely. But by letting your brain hear that sound, if you introduce white noise, it kind of helps the brain relax. It helps you relax. You're not stressing out and focusing on it as much. But over time, it will train the brain to acknowledge that the ringing is there, but not focus on it. Because even those who do wear hearing aids, not everyone wants to sleep in them, stuff like that. So there will be times where something that works for you throughout the day, you can't always have at nighttime. But if it gets to that point, there are even pillows with sound therapy built in that you can fall asleep to. There are apps where you can set timers to turn it off so you fall asleep to the sound of a babbling brook or white noise or whatever it might be. So again, it's so subjective for each person. Sometimes, a lot of the times, is associated with a form of hearing loss, whether that's sensory neural or conductive. So step one, I'd say start with a hearing test. But if it's not a hearing test, if it's not hearing loss, there are still treatment options out there. So just knowing that you're not crazy, there is a sound that is being produced in your head sometimes helps people a lot, because it's very disconcerting to hear a noise that no one else hears. And you go, oh my God, what's wrong with me? Do I have a tumor? You kind of jump to worst case scenario, but there are plenty of treatments out there.
Awesome. Thanks. That's interesting about the pillow. I hadn't even thought of this as a product that would be available. Um, our next question, Katie, is also for you. The question is, I have visual vertigo. Could this be related to an inner ear issue?
Oh, my question for you would be, have you ever been to a specialist about that? Yeah, absolutely. I would encourage you to go to most ear, nose, and throat physicians. Sometimes they deal with balance, but find an ENT that deals with vestibular issues specifically. Again, treatment can be so different for each person. I worked in a balance clinic for a little while, and that's a whole different set of tests that you go through. But yeah, I would definitely encourage you follow up with someone locally who specializes in vestibular disorders. And yeah, they'll put you through several different tests, but then they can come up with a treatment plan that works best for you.
Awesome. That's super helpful, I think, for our question asker. I'm moving quickly. We've got two more that I'd love to get to before we wrap up here. Mary, this question's for you. And I think that we've been hearing sort of a similar theme here. And, what's your first step if you're experiencing hearing problems? And I'm still going to ask this question. If your hypothyroidism is under control, are we still at risk for hearing loss? I've been experiencing hearing problems, but my labs are normal. I think the next question would be, what should I do? What's my first step?
Okay. Well, first of all, labs are normal is not how we view things. We want labs that are optimal. So my first question would be, where do your labs line up as far as optimal treatment? So just being in the normal range or being in the reference range is not enough to alleviate many symptoms of hypothyroidism, whether the hearing is related or not. You can have weight gain and fatigue and hair loss and all of that, even when you're at the top end of the reference range. So we want to look at whether those numbers are optimal, number one. Number two, if you're still having the hearing issues after you're optimal, then the next step obviously is that we need to get in and have a complete evaluation and have things looked at and go through this process that Katie is describing, because the longer we wait to do that, and frankly, I guess my advice is to do this simultaneously. I mean, if I'm having any sort of hearing issue, I'm not going to say, oh, let me give it 3 months and see if getting my thyroid tweaked and optimized is going to help it. No, I want my thyroid optimized and tweaked, but I'm going to get myself in and be seen sooner rather than later, so that if there is something else structural, or as in my case, big old, candle worth of earwax in my ear that can be, hoovered out, why not? Let's get that solved right away. If it may be something short term, as Katie was saying, it might be a steroid medication that within, a week or 10 days is going to resolve things. It may be allergies, whatever, but I think it should be simultaneous. I think you should pursue optimal thyroid treatment so that that is not a factor contributing to the issue, and go down the track with an ENT and audiology consultations in order to make sure that you're looking at the ear structure and any potential conditions or diseases affecting the ear.
Thanks, Mary. I think that makes a lot of sense to take a 360 approach to something, as opposed to, like you said, waiting and not living your full life.
Right.
Katie, my last question is for you. It's kind of a fun one. It's not even really related to hypothyroidism. You mentioned that you're not a big fan of Q-tips. Someone would like to know your thoughts on earwax candles. And maybe you can tell us what an earwax candle is.
So an earwax candle, if you do a quick Google search, you'll see all sorts of things out there. And it's like this really long thing that you set on fire, and basically the smoke is supposed to pull earwax out. I personally am not a fan of any sort of flame next to my face. So I would caution, be very, very careful, or just don't use them at all, is my recommendation. I will say they don't completely remove the earwax. So especially depending on how much impaction there is, earwax this grosses some people out. It doesn't bother me, but earwax can be sticky. It can be hard. It can be flaky. It's all about your geographical region and humidity, and just even kind of your own genetic makeup. So it can be very different for each person. So if it's impacted, smoking earwax candles are not going to remove that. So Again, if you want to each their own, but I would do a big disclaimer. Something smoking that is a flame next to your ear, it's always best to just go to a licensed professional when possible.
Can I get one quick question in here? Because I'm one of these people that, feel like I could open a candle factory in my ears. What are there any other things that I can do to minimize the earwax? I mean, my ENT said, well, I'll give you some steroid drops and every week put a little bit in, and just to keep it in, any inflammation down, and periodically use some Debrox to soften the wax or whatever. But I mean, is that enough? I mean, I see these devices now that look like corkscrews you can stick in. I know not to do the Q-tips, but what can we do? Because again, a lot of thyroid patients have this earwax problem. Is there anything we can do besides just rushing to the doctor every time we need our ears cleaned out to help keep that wax to a minimum?
I have seen the corkscrew things that you're talking about, and that seems even scarier than fire, in my opinion. So that's a great question. So the Debrox ear oil that you can put in, that helps keep earwax nice and soft. And I will say earwax is antibacterial, it's antifungal, it acts as a lotion for your ear. So without it, if your ears are super itchy, you've probably gone a little bit too hard with the Q-tips, so lay off of them for a little bit. But you can even just, if you're in the shower, something very free and simple. If you feel like you have earwax build up, just kind of lean over, let some hot, warm water run in your ear. And then if you just let it run out after about 60 seconds, if there is anything, it kind of helps break that up and run out. So obviously that's different if it's completely impacted. That's a whole different set of treatment, but something just simple that you can do is drops in your ears to help keep it soft will be the best thing that you can do, because it will help push things out over time and act the way it's supposed to. But everyone's anatomy is different. Some have super, super tiny canals. And unfortunately, sometimes the best thing you can do is just set up a reoccurring 3-month visit with your local specialist to get that removed if needed.
Well, and I'll add one more thing that I learned the hard way, which is that the doctors have said, if you do have wax and you're coming in to get it cleared out, for a couple nights before that, use the Debrox, because it'll make it so much faster and so much easier, rather than them having to go in and dig around and spend all this time on it. They can just basically slide it right out and get at it more quickly when you've softened it up and pre-treated it. So I learned that after they had me go home and come back another day because they couldn't get the wax dislodged. So
definitely.
Thank you both so much. I've never heard of this corkscrew thing before, so I'm going to go Google that, and I promise Katie to not use it. Thank you both for your time and so much information. Mary, I know a lot went into your research and survey, and you brought a really important viewpoint about thyroid related to hearing loss. And Katie, thank you so much for being our in-house expert tonight on audiology. So for everyone who's joined us, thank you for your time. We will send out a replay of this event with contact information and information about the things we've mentioned tonight within 24 to 48 hours. So you'll see that in your inbox. And we hope you'll join us on this Thursday for a thyroid healthy breakfast brainstorm with Ginny Mahar of Hypothyroid Chef, who's I know this is a hard thing sometimes for us to find things that we can eat for breakfast that's not super boring. So Ginny's gonna help break down what she's learned and give us some inspiration for the kitchen. So thank you all. I hope you have a good afternoon or evening wherever you are, and we will see you soon.